Good morning. Thank you for joining us today. We are just getting started. We're doing a brachioplasty, extending all the way into the axilla, so right there in the armpit area, sort of into the breast. Where is he? Well, he's right in front of me. We are live on our YouTube, so if you'd like to see the surgery happening, you guys can join us over there at Dr. Jeneby Plastic Surgery. On YouTube, we can actually show the surgery happening. So we got Dr. J and we have Dr. Phillips over here today working on their first case of the morning. So if you'd like to join us over there, we do have it linked in our link tree, which is in our bio. Or you can search it on YouTube. It's going to be at Dr. Jeneby Plastic Surgery. Let me know if you need help finding it. Again, we are doing a brachioplasty today, so an arm lift. And we are extending it into the axilla, which is that armpit area, sort of into the breast, to help remove more of that stubborn fat and that loose skin. So if you guys have any questions, feel free to leave those down below. Again, we're just getting started. With a brachioplasty, it's going to take about an hour to 3 hours usually, but with it extended to the axilla, so we're like lengthening that incision that we make down into our patient's side armpit area. It does take a little bit longer. It is a lengthier procedure, but it is very effective and it is very common to get done here. So feel free to comment any questions. Hi, thanks for joining us over there on Dr. Phillips' page. Hope y'all are having a good Tuesday morning. Again, we're just getting started on our first case. If you'd like to join us over there on YouTube and see the surgery happening in live time, you can do that as well. You can find us at Dr. Jeneby Plastic Surgery. Good morning, good morning.
Whatever you did, Doc, is reducing the blood issues. The DD and the TXA, it works really well.
Ma'am Wencinto asks, hi, how much is it to burn belly fat? Great question. It is going to vary depending on the patient themselves. If you would like a more accurate estimate, you can fill out that get a quote button and we can provide more accurate information. But generally, if it's just liposuction, usually we'll see other surgeries paired with lipo, so like removing fat. Usually you can expect anywhere from like 5,000 onward. But for more accurate pricing, you can fill out that get a quote button. It's free. It takes about 1 minute. And if you have trouble finding it, it's just going to be linked here on the bottom corner or up here as well. But great question. It really just depends on the patient, how much fat that they have, and some other factors as well. If you have any other questions, you can leave your information with us, and somebody from our financing team can reach out to you
8 centimeters.
to give you a more accurate estimate, more accurate numbers to look at. And again, we are doing a brachioplasty, which is an arm lift. And we are extending that into the axilla on our patient. So we are making that incision down her arm, into her armpit, and sort of going into her breast. And that is just to remove all of the fat that hangs like from her arm and in her armpit to make it all look really nice and tight. If you guys have any questions about today's procedure, some other ones that we do here with Dr. Jeneby and Dr. Phillips, please feel free to comment those down below. I'd be more than happy to answer those for you. So right now, Dr. J is on our patient's right arm. See if I can get a little bit of a better view. And so he's just starting with that very long incision that starts from the arm, so about the elbow, about here, and then goes all the way down. It is a very long incision that he has to make. And then what he's going to do is remove some of the excess skin that just hangs there. And then of course stitch it back up, so it's going to look like that there was never skin hanging there from the beginning. And since the incision is under the arm, it's hidden very well. It's not very noticeable. Thanks for liking the live. Miss Texas, we appreciate it. Thanks for joining us. Again, hope everyone's having a great Tuesday morning. We will be live later on today. If you guys are interested, you should tune in, give us a follow, and you'll be notified every time we go live if you don't want to miss out. Oh, thank you. We appreciate the gift. So again, this is our first case of the day. We are doing a brachioplasty, so an arm lift, and we are also extending that into the axilla, removing some excess skin from there as well, just to make it all look really nice and tight, and like there was never that loose skin there and fat to begin with. Oh, thanks for joining us over there on Dr. Phillips. We appreciate it. Thanks for liking the live. Again, hope y'all are having an amazing Tuesday. Later on, we have some interesting cases. Later on, we'll be doing a breast augmentation, and we will also be doing
Alexa, turn it up.
a lift today as well. So if you guys would like to see what that looks like, and tune in for that. Definitely stay tuned, give us that follow, and you'll be notified the next time that we do go live.
Rock axilla, 5.5 centimeters.
So right now, Dr. J at Dr. Boom Boom Pow here on TikTok, and Dr. Phillips, they are removing that excess the excess skin. from our patient's right arm. Little Miss Texas there on our on Dr. Bam's TikTok says, "Ooh, Dr. Jamie, yes ma'am. It is a party in here always." Nene asks, how much for a tummy tuck? Great question. Usually it's going to vary patient to patient.
Start, Doctor.
It's going to vary patient to patient. So, but you can expect to pay anywhere from like $7,000 up. A lot of times people will also get like other surgeries paired with just a tummy tuck. We'll usually see either surgeries paired with one another or added on with whatever other procedure they're getting done. So usually we'll see, like, if we see any kind of lipo, we'll also see like maybe a BBL done, or we'll see somebody getting like a breast lift done with like some lipo, or like an arm lift and their breasts done. So if you're just wanting a tummy tuck, what would be really helpful for you is just filling out that form that we have pinned here on the screen. Once you fill it out, it's about 1 minute, it's free. Once you fill it out and submit it, somebody from our team will look over all your information, and then based off of that, we'll reach out to you and provide you with information about any of the surgeries that you are inquiring about or interested in. Yeah, Nene, we are located in San Antonio, Texas. San Antonio, Texas, the Stone Oak area specifically. So if you're familiar, that's just northern San Antonio. But for those of you who are maybe out of state or live far away, we do offer a lot of financing options, and we do offer a lot of accommodating options as well. So don't hesitate. I would still definitely fill that form out and still inquire, because we do offer a lot of services for those who aren't close. And somebody from our team would be more than happy to assist you in that process and figuring out what's going to work for you. But yeah, if you guys have any questions, feel free to comment those down below. I'm going to kind of walk over here and try to get a little bit of a different angle here.
As Baby Brown says, ain't no one got time for that.
Dr. Hernandez, can you raise that intensity of the light, please?
So if you'd like, you can join us over there on our YouTube. We are live there, and we are showcasing the surgery and our surgeons. You can find us at Dr. Jeneby Plastic Surgery. We are live with Dr. Boom Boom Pal and Dr. Bam here on TikTok. For those of you who see me looking on one screen to the other, that is why. So we have Dr. Phillips now on our patient's right side and Dr. Jeneby on the left. So Dr. Phillips is going in on that axilla where Dr. J had made that super long incision from the elbow down into the axilla. He's now beginning to stitch it up. They've already removed some of that excess skin. Even after that lipo, they've already removed that excess skin. And so now Dr. Phillips is just going in and stitching part of it back up. And then Dr. Boom Boom How is on the left side of our patient and is getting started on making the incision from, our patient's about elbow to the axilla. So that's going to extend all the way from the elbow down to our patient's armpit, past the breast a little bit, and into like her breast slightly. So it is a pretty long incision to see and to have to stitch up. But again, it is really fascinating, and because it's hidden under the arm after the surgery or after the stitches are made, it's not noticeable. It's hardly ever seen, so it heals pretty well. It fares pretty well. A lot of people, it is a common procedure that we do see. A lot of people are happy when they do get it done. And it's just to remove that excess skin that hangs, or maybe you've lost a lot of weight and you just have all that extra skin, or even fat there too. That's great. A brachioplasty is a great procedure to have done if you had either of those. And we will be live at other points during the day, so definitely tune in. If you're interested in seeing some of the other cases we have going on, later today we will be doing a breast lift, and then our last case of the day is going to be a breast lift. We're doing some lipo to different areas of her body, so we'll be doing lipo on her abdomen, around her flanks, and some other areas as well. So if you guys would like to tune in and see what those procedures look like and ask any questions about those, you can give us a follow and you'll be notified anytime that we do go live. So right now, Dr. Phillips is here on Dr. Bam. He is just stitching our patient's right arm, putting some stitches in where Dr. J had made the incision earlier. So they've already removed some of that extra fat and skin that kind of hangs down. So Dr. Bam is just stitching up where Dr. J had made that incision, and then Dr. Jeneby is on our patient's left side, basically repeating the same process over, but on our patient's left side. Got started about 30 minutes ago. Again, this is our first case of the day. We're doing a brachioplasty and extending that into the axilla. So what that looks like is it's just an arm lift, so removing that extra skin and fat. And then sometimes whenever we remove the extra skin and fat from the arms, whenever our patients will rest their arms, or when people will rest their arms, they'll see like that armpit fat that tends to poke out. And so when we extend it to the axilla, it removes that armpit fat as well. So it is an add-on to just a regular breast lift, but it is highly recommended. Again, it's not for every case, but it is highly recommended if you do struggle with more fat poking out around your armpit and from your back. And that is what our patient decided to have done today. So an arm lift with it extending into her axilla. Again, for those of you who are just joining us, we are live on our YouTube as well. If you'd like to see that surgery happening, see it live, see the patient and our surgeons, you can join us over there at Dr. Jeneby Plastic Surgery. Again, we are doing a brachioplasty, which is an arm lift, and we are extending that into the axilla, which is in that area by our patient's armpit, into the lower breast area. We have Dr. Bam on our patient's right side, just stitching up where Dr. Boom Pow made the long incision from the elbow down into the axilla. They've already removed the excess skin there and did some fat removal as well. Hello.
So, what's the system the nurse station?
Hey there on our YouTube, Daniel. Thanks for joining us.
7.5 on the left.
Good morning. As you can see, Dr. J's removing some excess skin on our patient's left arm. Again, we are doing a arm lift today, so a brachioplasty, extending that into the axilla, so it then becomes an axilloplasty. We've been operating for a little over 30 minutes now. Since we do have Dr. Bam here and Dr. Boom Boom Pow, it's not going to take as long as it usually would. Usually you can expect a surgery like this to take around 3 hours, 1 to 3 hours. But with Dr. Bam and with Dr. Boom Boom Pow, it may take a little less, about an hour to hour and a half. Jonathan says good morning. Good morning. Thanks for joining us over there on our YouTube. What do you think so far? We have Dr. Phillips there on our patient's right side and Dr. Jeneby on the left. So for those of you who are on our TikTok, we are live on our YouTube as well. So if you'd like to join us over there, feel free at Dr. Jeneby Plastic Surgery. Good morning, good morning. We are doing a arm lift and extending that into the axilla.
4.5. 4.5 on the axilla.
4.5 axilla. Checked it now, but it'll come out later.
We'll be live for a few more minutes. Someone on our YouTube asked, what is the recovery time of when they wake up? Great question. Well, it's going to vary patient to patient. For a procedure like this, so an arm lift into the axilla, it's gonna take, usually we expect about a month, so 4 to 6 weeks. Of course, even after that, you want to be gentle with your body. So recovery time until you're fully healed could take anywhere from like 6 months to a year, but of course you want to be more gentle with yourself right after surgery. So until you can like return back to normal life and start doing like exercising or normal activity, it's going to vary, but usually about 4 to 6 weeks is when the surgeons recommend you just kind of relax and take it easy. Again, it's going to vary patient to patient. And if you get other procedures added on, and of course age is a big role in that as well. Everyone heals differently and at a different pace. But again, about 4 to 6 weeks. If you have any more questions, I can get you in contact with somebody from our team about what post-op would look like. If you're interested in having a surgery done yourself, you can fill out that get a quote button that we do have pinned on our pages. It takes about 1 minute. Once you fill it out, it's submitted. Somebody from our team is then able to reach out to you, and that gives you another time to ask any questions about any operations, what financing is going to look like, what the procedure is going to look like, other processes, and things like that. But great question, Daniel, over there on our YouTube. Hope everybody is having a great Tuesday. We will be live for a few more minutes here. And then we are going to let Dr. Bam and Dr. Boom Boom Pow finish up and get our patient stitched back up and ready to go. So if you guys have any more questions, we'll be live for a few more minutes. We'll be live later today as well. You can stay tuned for some of our other cases we have going on today. You can give us a follow, and it notifies you every time that we do go live. So if you don't want to miss out, definitely consider. But again, if interested, we do have that form pinned. You can fill it out once submitted. Somebody from our team receives all that information. Then they're able to reach out to you. That gives you another opportunity to ask questions. We are able to set up consultations from that form, get you connected to other people on our team. They're able to explain what the process is like. They can explain financing, accommodation, booking, all of that. So take advantage of that. It's free. It takes about 1 minute. But again, thank you for those of you who tuned in and joined us this morning. There on our YouTube, Daniel asks, when could they go back to work? How long did it take? Yeah, great question. So again, it is going to vary patient to patient, but at least you probably want to give yourself at least 2 weeks. And since it is our patient's arm, you don't want to be moving your arms and adding to the prolonged healing process. So you want to give your body definitely enough time to just completely rest and heal as much as it can before you return back to work. So at least 2 weeks, but if you can longer, that'd be great. But you can work after 2 weeks. You just want to give your body that time to just recover a little bit before returning. And again, even at work, you don't want to be pushing yourself. Like if you're doing something very labor extensive, then maybe a lot longer than 2 weeks. But if you're sitting at a desk all day and like writing on the computer, I mean, it's just going to depend what your work situation is like, and again, your body. But it is going to vary, but generally 2 to 4 weeks. But great question. I think with a surgery like this, you would expect like a lot longer, which of course, like your arms, you need to move them a lot throughout the day. So it's normal to, even during the healing process, to like have to move them and to need to move them. So it's okay if you do have to return to work earlier than like 3 weeks or 4 weeks, because it's expected. But the more time that you can allow your body to heal before returning, the better. So I hope that helps. Alright, you guys, we've been live for about 30 minutes. We will be back on later this morning, for some other cases that we have. So stay tuned for those. For any of y'all that are interested in some of the procedures that we have and you're ready to take the next step, you guys can fill out that form that we have pinned here on our screen. Once you fill it out and submit it, somebody from our team will reach out to you. You can ask more questions about financing and booking and consultations and other options and services that we provide there. But thank you guys for tuning in. We will see you later.